we have come a long way. The neurosciences are exploding with progress. Pacific Neuroscience Institute is the embodiment of this collective momentum and at the forefront of providing groundbreaking therapies while working hard to create novel solutions for some of medicine's most daunting problems. Formed over a decade of progress, our expertise has grown. Our multidisciplinary team is now working together across 7 centers of excellence, including Pacific Brain Tumor Center, Pituitary Disorders Center, Eye, Ear, and Skull Base Center, and our new Pacific Stroke and Aneurysm Center, Movement Disorders Center, Adult Hydrocephalus Center, and Facial Pain Center. Although the disorders our patients face are complex, our goals are simple: targeted therapies that minimize collateral damage and rapidly restore and sustain quality of life. Here is a glimpse at what we are doing today. For patients with brain, skull base, and pituitary tumors, we are leading the way in breakthrough treatments, including endoscopic keyhole surgery, personalized genomic and immunotherapies, and stereotactic radiosurgery. For patients with acute stroke and cerebral aneurysms, our cutting-edge endovascular and microsurgical therapies are saving brain and saving lives. For patients with Parkinson's disease and essential tremor, tailored medical therapies and deep brain stimulation are restoring function and independence.
I in no way imagined I would ever have a brain tumor. That was totally horrifying, and I do have to say, Dr. Kelly was so awesome in taking you down from the heights of panic. I had 3 surgeries right in a row, and the brain surgery was by far the easiest. I had a very quick recovery. I was out of the hospital in like 3 days.
Through relentless searching, my wife and I, we discovered this minimally invasive technique called a supraorbital craniotomy, which was performed by Dr. Daniel Kelly in Santa Monica, California. So it wasn't just around the block, but you know, if Dr. Daniel Kelly would have been in China, I would have been in China. 2 days after the surgery, I still remember my wife, she was right in front of me when they took the bandage off, and she's like, wow. She's like, you can't even see the incision.
Recovery after the surgery, the vision started to recover fairly fast. Already the first day I noticed that the color vision in my affected eye had gotten better. I'm very glad I came here to LA to meet Dr. Griffiths and Dr. Krause.
Dr. Kesari wants to be involved in developing the cure for glioblastomas.
It's really motivating, and there's the reason we're here, is to find a cure for brain cancer and to give patients options that they would not otherwise have at any other place.
And through a neuroscience research center with the John Wayne Cancer Institute, we are conducting brain tumor translational research and clinical trials. We are also exploring new neurorestorative treatments, including stem cell therapies for stroke and brain injury, vaccines for neurodegenerative diseases, and leading-edge technologies such as transcranial magnetic stimulation and focused ultrasound for brain tumors and tremor. Through our fellowship training programs, we're also training the next generation of clinician scientists in neurosurgery, neuro-oncology, and other specialties. With joint fundraising support from St. John's Health Center Foundation and the PNI Foundation, we will further expand our efforts in research, fellowship training, and patient education. And where does this all happen? Right here at our award-winning Providence St. John's Health Center, the soon-to-be completed PNI clinic, and across our Providence Southern California affiliates. The neurosciences, one of the final frontiers in medicine.
It's been an incredible journey, and we're just getting started.
Help us make a difference.
Join us.
Join us.
Join us. Join us. Pacific Neuroscience Institute, delivering personalized precision care today while innovating for tomorrow.